everybody in, I will.
Awesome.
All right, let's get started. Thanks everybody for coming out this morning, sharing some time with us on an important topic. It's been an interesting past couple months, as you know. I think this is our 40th or something different webinar we've done on different topics, and so it's been busy, and I know it's really busy for all of you out there, and it's been challenging at times. So we're trying to keep you up to date with the most current information we can and get you right from the sources, and we've been doing that with CRA yesterday, and we're lucky enough and happy to have WorkSafe with us here today. As you know, a bunch of new requirements came out the other last week or the week before. Time's running all together for me right now, about how to reopen your business. So we thought, great, let's get WorkSafe out here once they've got everything kind of documented. And we're lucky enough to have Jose and Megan from WorkSafe with us today. So Jose is going to lead us through a little a presentation in a minute. After the end of the presentation, we'll take questions. But anytime during and the questions will be done via the chat portal at the bottom. So if you go to the bottom of the screen and click on chat, put your question in there. We will answer them at the end. And Megan will be monitoring them throughout the events, the presentation. So if you come up, if you have a question on something Jose's presented, please put it in there. Megan may answer it. We'll review it with everybody. She's already put in there a link on the chat to WorkSafe, so you can go on there to get some of your questions answered afterwards also. So we're going to give you tons of information, get your questions answered. As Jose goes through the presentation, I think all your questions may get answered. So without any further ado, I'm going to turn over to Jose to take it from here and roll us through the presentation. Jose, thank you.
Thank you very much. And before we start, let me do a brief introduction myself. My name is Jose Barranco. I am an occupational health and safety consultant at WorkSafeBC, the department that we name the Consultation and Education Services Department here at WorkSafeBC. WorkSafeBC recognizes the unique challenges faced by all industries in keeping workers' health and safety during this COVID-19 pandemic. And we are working with workers, employers, and industry associations across the province to ensure workplaces remain healthy and safe during this challenging period. Let's discuss a little bit about what are going to be the main topics that will be reviewed during this session. So first of all, every employer is required to have a COVID-19 safety plan that assesses the risk of exposure at their workplace and implements measures to keep workers safe. If a formal plan is not already in place at your workplace, you're expected to develop it while protecting the safety of your workers currently. To help you to develop this plan, I will be walking you through some of the following topics throughout this presentation. The first topic we will be discussing is some basic information about COVID-19 facts, which will include some symptoms, how it spreads, and what to do if you or your workers experience these symptoms. Next, we're going to discuss some expectations on how to develop your COVID-19 safety plan. And we're going to discuss some of the strategies that you can implement at your workplace to keep your workers and yourself safe. We're going to focus on a list of hierarchy of controls that will give you different priority of the different controls that are available out there. I will also walk you through how to develop your COVID-19 safety plan. And I will also let you know which resources do we have available from our side and also from other resources from other organizations that will be of help during this process. I got around 45 minutes for my presentation, so I will leave the remaining 15 minutes for any questions that you may have, and that we will be using the chat box for that. Before I begin discussing some of the specifics, I need to acknowledge that this presentation is showing the most current information that we have developed by late April. So given that the situation is changing rapidly, some of this information might change over the next days or weeks. So first of all, let's understand some of the COVID-19 transmission facts. First, COVID-19 is a virus that can cause respiratory illness and can lead to hospitalization and death. Older people or people with a weakened immune system or people with underlying health issues are at a higher risk of severe disease. Younger and otherwise healthy people are also at risk. The symptoms of COVID-19 are similar to other respiratory illnesses like the common cold and flu, and they include fever, chills, new or worsening cough, shortness of breath, new muscle aches or headaches, and sore throat. People infected with COVID-19 may experience little or no symptoms, with illness ranging from mild to severe. Watching for symptoms of COVID-19 can appear, or these symptoms may appear in the 14 days after being exposed to the virus. Now, let me explain a little bit of how this virus spreads. First of all, coronavirus are transferred via infected droplets contacting surfaces in the eye, nose, or mouth. Second, coronavirus are transmitted via liquid droplets when a person coughs or sneezes. These droplets typically spread only 1 to 2 meters and quickly fall to the ground. However, the virus can enter through the eyes, nose, or mouth if you're in close contact with a person that will be sneezing. The virus is not known to be airborne, and it's not something that comes through the skin. The third item around transmission is that it can be spread by touching something that a person has touched if they have used their hands to cover their mouth while sneezing. That is why we're recommending people to cough or sneeze on a sleeve or a piece of tissue or in the crease of the elbow, and washing the hands regularly. It can also occur if you touch any contaminated surfaces that an infected person touched. For example, when you're shaking hands or you're touching an infected person. So let's explain a little bit around the transmission risk factors. The factors that you're seeing on your screen right now are the ones that we have identified that you should be considering as the base for the risk assessment. If any of these conditions exist at your workplace, the risk of COVID-19 virus being transmitted from person to person increases, or by contacting any contaminated surface. And we will discuss a little bit around the specific protocols that you need to have in place to cover for these situations. Well, the first thing that we need to discuss under the protocols will be what to do if you or your workers experience flu-like symptoms. Anyone experiencing these symptoms should immediately inform their supervisor, physically distance from any other people, leave the workplace, and seek medical advice from a healthcare professional. To do that, we know that we can call the 811 line anytime to talk to a nurse at HealthLink BC and get advice on how are we feeling and what to do next. As you may know also, there is a self-assessment tool that can be consulted online to determine whether further assessment or testing is needed for COVID-19. Anyone exhibiting any of these symptoms should not be at work and should consult with their healthcare provider before returning to work. Now, let me discuss a little bit around how you're going to develop the COVID-19 safety plan that I referred to earlier in this presentation. The employers, or any employer in the province that is restarting their operation, needs to have a COVID-19 safety plan that outlines the policies, guidelines, and procedures they will put in place to reduce the risk of COVID-19 transmission. You don't need to have a formal plan in place to begin your operation, but you are expected to develop it while protecting the safety of your workers. The provincial health officer's orders state that you must post a copy of this COVID-19 safety plan on your website. Of course, only if you have a website. And also it should be placed at your workplace so that it's readily available to review by workers or other persons that may attend to your workplace to provide services, or in case you receive members of the public. We have developed a template that will help you to develop this COVID-19 safety plan following 6 steps that I will be discussing in a little bit more detail over the next slides. So before we go into the specifics of the plan, let me tell you a little bit around where is the information coming and how we're organizing all the information that we're receiving from the provincial health officer to make sure that everybody is aligned under the same message. So there are many things that you can do to prevent the spread of COVID-19 in your workplace. However, the most important thing that you need to do is to follow the orders, notices, and guidance from the provincial health officer that will be applying to your workplace. First of all, physical distancing means limiting close contact with others. When outside of your home, practicing social distancing by keeping 2 meters from one another is something that we can all do to help stop the spread of COVID-19. Cleaning your environment with regular household cleaning products can help prevent the spread of illness, including COVID-19. Focusing on frequently touched surfaces and items will help you to prioritize which items to clean first and more frequently. Covering your mouth and nose with a disposable tissue or the crease of your elbow when you sneeze or cough, washing your hands with soap and water for at least 20 seconds, and using soap and water, and also using soap and water in this process are one of the most effective ways of reducing the spread of infection. Whenever soap and water is not available, you can always use hand sanitizer to clean your hands as long as your hands are not visibly soiled. If they're visibly soiled, what you can do is you can use any wipe to wash or clean your hands first, and then use the hand sanitizer to clean them. Do not touch your face, eyes, nose, mouth with unwashed hands. And also do not share food, drinks, utensils, or anything that you might use to take any food. Now that we discussed the basics and where the information is coming and how we are aligning this information, let me discuss how the plan looks like. So what you're seeing in your screen right now are the 6 steps that have to be followed when developing your COVID-19 safety plan. This information is in our website, and as I said before, we have included a template that will help you to develop a plan to ensure you minimize the risk of transmission, and also to make sure that your business can operate safely. It's important to note that this information is guidance, and it represents only the minimum requirements that you may identify any additional requirements that you need to implement at your workplace. Now, let's delve into step 1. First thing that we need to consider in step 1 is that employers must assess their workplaces in order to identify places where the risk of transmission is introduced. And this is part of the assessment process. This process that I'm mentioning must involve frontline workers, supervisors, and your joint health and safety committee. And I will discuss a little bit around how is this done. If you don't have a joint health and safety committee, you need to consider using worker representatives to get feedback on all the assessments and all the things that you're considering to keep people safe at your workplace. You should also continue to assess your workplace after operations resume, and if you consider that any of these risks need to be managed using a different process, you need to be feedbacking that into your policies. As we know, the virus spreads in several ways. We know that it's spread through droplets when a person coughs or sneezes, or from touching contaminated surfaces before touching your face. To understand the risk at your workplace, I laid out some questions that you need to start asking yourself when doing this assessment. The first one is around, where do people congregate? It could be break rooms, it could be production lines, it could be meeting rooms, and it will differ depending on the type of operation that you have. The second question is around the jobs and the tasks or processes that require workers to stand in close proximity to one another or members of the public. Third question will be around the tools and machinery and equipment where people come in contact with that need to be cleaned, or maybe you need to limit the use of them depending on your specific situation. And the last question will be around what surfaces are touched often at your workplace, such as doorknobs, buttons, light switches, equipment, and any shared tools that you might have at your workplace. Now, let me talk a little bit about involving workers. So your joint health and safety committee and your worker representative should be helping you to define or to assess the risks and define protocols for prevention of COVID-19 transmission. So given that they play such an important role, let me explain a little bit how this works. If you have 9 employees, but fewer than 20 workers at your work site, by regulation, you need to have a health and safety representative at your workplace. And whenever you have more than 20 workers at your work site, you need to have a joint health and safety committee. This requirement is not new and has been in place since many years ago. Now, the process that we're trying to do is how to use these health and safety committees and worker representatives so we can get all the information that we need to prepare our safety plan. Now, this committee will give employers a way to work together to identify and find solutions to health and safety issues. And these will include concerns related to COVID-19. Some of the things that you need to make sure that are in place at your workplace to make sure that this is happening properly is, first of all, ensuring there is a mechanism in place where workers can raise concerns around the risk of exposure at the workplace, and they can inform that through either your committee or your representative. You also need to have meetings, and you need to make sure that your committee is participating in walkthroughs when you are assessing the risks of COVID-19 transmission. You also need to make sure that you are involving your committee or your worker representative in the development of the control plans that you're defining in your safety plan. And a good thing that you might want to include into your committee strategy or worker representative strategy is to make them participate in promoting the approved physical distancing measures at your workplace. And last but not least, make sure that your joint health and safety committee has the tools and the time to provide feedback to any of the controls or protocols that you have put in place. Also, joint committees need to be meeting on a regular basis. And this is under the requirements of the Occupational Health and Safety Regulation currently in place in British Columbia. So we know that in-person meetings are currently challenging to do, so we are encouraging employers to use any remote connectivity tools that they can use to provide or to make sure that these meetings are happening. Now, let me explain a little bit more around what is needed under step number 2. Step number 2 has the definition of the protocols that you will use to reduce the risk whenever you have assessed it in step 1. And let me discuss a little bit around the protocols and the options that we have and some of the basics on preventing exposure. First of all, maintaining physical distance is considered to be one of the most important controls that you should be putting in place at your workplace. And how do you achieve these is done by several steps. The first one is consider to reduce the overall number of workers at the workplace at a time. And this might be done by implementing work from home schedules or rescheduling some work tasks at your workplace. Second, you also need to ensure that the appropriate number of people are in each area of a workplace to prevent workers from coming too close to another or to members of the public. This is done by placing occupancy limits at areas where you know that people might congregate and making sure that workers and the public are following these requirements. You should also promote that workers keep a 2-meter distance between each other as much as possible, and this needs to be shown in the organization of the tasks that you are defining at your workplace. Another option will be to creating pods of workers that work together exclusively in a specific area or in a specific shift. So you minimize the risk of broad infection or broad transmission throughout the workplace. And last but not least, you need to implement measures to ensure workers can maintain 2 meters distance when serving or working with members of the public, especially with front-facing operations. Now, we know that there are situations where physical distancing cannot be maintained. And for those situations, our recommendation first will be where distance cannot be maintained, consider separating people with partitions or plexiglass barriers. The second recommendation will be where any other measure is not sufficient, you should consider the use of non-medical masks, understanding that these masks have limitations. Now, let me talk a little bit around cleaning and hygiene, as we know that that's another important protocol that needs to be in place to prevent COVID-19 transmission. First of all, you need to provide adequate hand washing facilities on site for all workers so they can use them. And also you need to make sure that the location is visible and easily accessed. Develop policies around when workers must wash their hands, including upon arriving from work, before and after breaks, after handling cash or other materials, and before and after handling common tools and equipment. Second, you should also implement a cleaning protocol for all common areas and surfaces, including washrooms, equipment tools, common tables, desks, light switches, and door handles. Ensure that the people engaged in cleaning have the adequate training and materials to perform their tasks. And third is removing any unnecessary items or tools or equipment that may elevate the risk of transmission. Some of these items may include coffee makers, shared utensils that are not necessarily for the work to be performed. And in any situation where you can remove tools or simplify the amount of tools, it will reduce the risk of transmission. Now, when you are selecting the protocols for your workplace, we are recommending you to follow this barrier approach or level of protection approach. So let me explain a little bit on how this graphic works. What you're seeing here is that we have different protocols that offer different levels of protection, depending on how reliable they are or how easy they are to implement. Wherever possible, use the protocol that offers the highest level of protection and consider controls from additional levels if the first level isn't practicable or does not completely control the risk. My apologies. You might likely need to incorporate controls from various levels to address the risk of your workplace, meaning that you might need to combine them to achieve the desired effect. The first level of protection is considered elimination. And this is when you apply policies and procedures to keep people at a safe physical distance from each other or from customers. Ideas and protocols on elimination will be limiting the number of people at your workplace at any time, and implemented protocols to keep people at least 2 meters from one another and from customers and from the public, which will be reducing the contact transmission risk immediately. Now, when that is not practicable, you can go to the second level of protection, which are considered engineering controls. So this is a situation where you cannot always maintain physical distancing, and you would use then physical barriers, such as plexiglass, to separate people between customers or between other workers. The third level of protection is around administrative controls. And in this case, it's specifying the rules and guidelines that you will use, for example, for cleaning or for tool sharing or for traffic inside your workplace, that will be defining how to make sure that you are not having people close to each other at your workplace. And the fourth level of protection is considered the PPE protection. PPE stands for personal protective equipment. And it's considered to be suitable only when the first 3 levels of protection are not enough to control the risk. If this is the case, you need to supply workers with personal protective equipment or PPE, such as non-medical masks. And these PPE should not be relied as the only control measure in place at your workplace. It should only be used in combination with other measures. Now, let me talk a little bit around the protocols that you need to have in place for situations where you have workers traveling. So the practices around these first are limiting essential work travel and eliminating all non-essential work travel. Second, whenever possible, workers should travel alone in their vehicles. And if that is the case, employers must implement all of the necessary safeguards related to working alone or in isolation, ensuring the safety of these workers. Because remember that it's not only the COVID-19 transmission risk. Whenever these protocols are creating another hazards, we need to be looking into those too, like working in isolation. Now, if multiple workers are traveling in the same vehicle, some measures may be taken in place to ensure appropriate distance. Some of these include having workers to sit one to a seat, meaning that you have staggered seats to allow maximum distance between them, or adjusting the number of workers transported per trip. Or you can also increase the total number of trips needed to transport workers to a work site. These measures might mean that you need to have larger vehicles or maybe do additional trips as part of the process of transportation. Whenever it is not possible to ensure these 2 meters of distance between workers in a vehicle through this process, employers must consider the use of other control measures, such as PPE, that like we discussed in the previous slide. Now, employers must also implement a process that allows for physical distancing when loading and unloading vehicles. Workers waiting for an unload or load process should maintain physical distance while remaining safely away from traffic. Now, let me discuss a little bit around cleaning and hygiene practices when traveling. First, employers should have hand washing facilities or sanitizing stations available for them whenever they enter and exit vehicles. Also, employers must ensure that high contact surfaces within the vehicle are routinely cleaned. These include seat belts, headrests, door handles, steering wheels, and handholds. Now, let me discuss a little bit around the protocols for cleaning and hygiene. You need to ensure workers are provided with appropriate supplies, such as soap and water, hand sanitizer, disinfected wipes, nitrile gloves, and garbage bags, and also ensuring that you have sufficient washing facilities. You need to remind the staff of effective personal hygiene practices. You need to add signage about best practices for personal hygiene for customers who may interact for your workers. You also need to remove any shared items where cross-contamination is possible, and you need to enhance cleaning and disinfecting practices in high contact areas. Now, all of these should be done in combination with your training, supervision, and documentation processes, meaning that you need to train your staff on changes that you have made to these work policies and practices, and you need to keep records of this training. Also, supervisors must be instructed to ensure compliance with these health and safety procedures. Now, all of these things that we discussed were around the step number 2, the selection of protocols. I will discuss a little bit more around the specific protocols for different industries later in this presentation. But for now, let's focus on step 3, which is developing your policies. Now, the Provincial Health Officer and the BC Centers for Disease Controls have issued the following guidance around self-isolation, which we need to follow and need to implement in our policies. First, as we discussed earlier in this presentation, anyone who has had symptoms of COVID-19 in the last 10 days must self-isolate. Anyone under the direction of the Provincial Health Officer to self-isolate must follow those instructions too. Anyone who has arrived from outside of Canada or who is in contact with a confirmed COVID-19 case they also need to self-isolate for 14 days and monitor for symptoms. You'll also like to add within your policies situations where you need to consider prohibiting or limiting the number of visitors at your work site, and also considering to have a plan around workers who may start to feel ill while at work, including who should they notify in case this happens, and also how will they travel from their workplace to their homes. Now, on step 4, step 4 is all about making sure that all the policies that we defined and all the controls that we defined earlier are well implemented at the workplace by following a communication plan and a training plan at the workplace. So we need to make sure that everybody's trained on the measures that that you are putting in place at your workplace around staying, especially around staying home when sick. And you need to post signage, including occupancy limits and effective hand washing practices around your facility so people or workers are reminded about these practices. Signage should also be posted at your main entrance, indicating who is restricted from entering the premises. This includes visitors, workers, and guests. Now, on step 5, We're going to close the loop by monitoring the situation and making sure that we are updating plans as required. As I said earlier in this presentation, things might change in your business, and you need to identify the different areas of concern that arise in the workplace as you're implementing these plans. And if something seems not to be working, you need to involve workers into defining what can be done to increase the health and safety considerations here. Now, you need to ensure that workers can raise safety concerns so this process can work. These may be done, as I discussed, through the worker health and safety representative at your workplace or through your joint health and safety committee. Employers that have fewer than 9 workers at their site need still to have a process so they can raise any considerations or any issues from workers into the protocols that they need to have in place. And step number 6 is around considering all the hazards or risks that may arise from resuming your operations. This step comes as us understanding or comes from the situation where we understand that your business may have been shut down for a prolonged period of time. And when you restart operations, you may need to consider some extra items to ensure that whenever you're restarting, you are not creating additional hazards at the workplace. What you're seeing in your screen are a couple of questions that you need to ask yourself to address these or to consider to analyze these situations, and these are all included in the COVID-19 safety plan that I was referring to, the template that I was referring to earlier. Now, as I said, what you're looking at your screen right now is the first page of the COVID-19 safety plan template that we developed. Is a fillable PDF, meaning that you can download the PDF, you can follow through the steps, you can check the boxes, write the specific items from what you are considering in your policies, and then you can keep it for reference, posting, and then your communication and training plans to be executed. All of these resources are located at WorkSafeBC.com, and you can, I will show you where exactly you are going to see the links at our website in the next slides. So let me, before we move to the next topic, let me explain a little bit around worker expectations. I discussed a lot around employer expectations, but let me speak around what workers are expected to do. Workers should know and understand their workplace health and safety responsibilities, and those responsibilities they have to others. If you're a worker, you also need to understand that you have 3 rights: the right to know about hazards in the workplace, the right to participate in health and safety activities at the workplace, and the right to refuse unsafe work. If you're a worker, you also need to understand when not to come to work. The following workers must not come to work. First, as we discussed before, anyone with COVID-19-like symptoms should not come to work. Anyone who have traveled internationally and is remaining in their 14-day isolation period. Anyone who lives in the same household as a confirmed or clinical COVID-19 case who is self-isolating. And any workers who have been exposed to anyone confirmed to have COVID-19 or to anyone with possible symptoms of COVID-19. And these workers should call the Health Link line at 811 for an assessment and to determine next steps. So other preventative measures that workers need to consider at work will be complying with the employer's instructions around minimizing exposure and also asking questions if any of these instructions are not clear. Also, workers need to make their best efforts to keep at least 2 meters of distance from other people, washing their hands frequently, and using hand sanitizer if not available, and also making sure that they're cleaning and disinfecting their work environment as appropriate or determined by the employer. Now, a little bit of information around refusing unsafe work. If a worker has a reasonable cause to believe that performing a job or a task puts them at risk or someone else at risk, they must immediately notify their supervisor or employer. Then the supervisor or employer will take the appropriate steps to determine if the work is unsafe and remedy the situation. Supervisors and employers have a responsibility to investigate the matter and fix immediately or fix if possible. If the employer decides the worker's concern is not valid, they need to report back to the worker. If a worker still views work as unsafe after a supervisor or employer has said it's safe to perform a job or task, the supervisor or employer must investigate the problem and ensure any unsafe condition is fixed. This investigation must take place in the presence of the worker and a worker representative of the Joint Health and Safety Committee. The employer can also have a worker chosen by the workers' trade union. And if there is no safety committee or representing trade union at the workplace, the worker who first reported the unsafe condition can choose to have another worker present at the investigation. If a worker still views work as unsafe, they need to notify WorkSafeBC. Workers in BC have the right to refuse work if they believe it presents an undue hazard. Under the Workers' Compensation Act, an undue hazard is unwarranted, inappropriate, excessive, or disproportionate. Risk above and beyond the potential exposure a general member of the public face through regular day-to-day activity. If the matter is not resolved, the worker and the supervisor or employer must contact WorkSafeBC. A prevention officer will then investigate and take steps to find a workable solution. So let me discuss some of the industry-specific protocols that we have in place for employers as they start reopening. So as you may know, the information that I'm showing in this slide is showing the two phases that we are currently under for reopening businesses in the province. Anything that is under phase 1 was what we consider essential businesses that had to be open since the pandemic started. And businesses that are in the phase 2 section are businesses that are considered good to be reopened onwards from mid-May. So all of the protocols that are defined for phase 1 and phase 2 employers can be found at WorkSafeBC.com, and I will show you in the next slides where will you find this information. So first of all, WorkSafeBC support and services. The image that you're seeing right now on your screens shows how our website looks like when you log on. So the first thing that you can do is when you access the COVID-19 information and resources link by clicking on the image, is to find any recent updates that we have placed on COVID-19 information. These could be also accessed from the top section of our website, and this includes information around health and safety, and also includes information for specific industries, as I discussed earlier in this presentation. Let me talk a little bit around the prevention efforts that we're doing at WorkSafeBC. Prevention officers and occupational health and safety consultants like myself are providing information to workers and employers, which focuses on the controls that the employer can use to limit exposure. Prevention officers are engaging in inspections, consultation, and education activities, while occupational health and safety consultants are engaging in consultation and education activities such as this one. This is to ensure everyone in the workplace is fulfilling their obligations and businesses have the support they need to prevent exposure to COVID-19. Now, on the claims side, we also are continuing to provide the services that people rely on, including the services offered to those who suffer a work-related injury or disease. The call centers that we have remain open, and they are continuing to adjudicate and manage new and existing claims. During the COVID-19 outbreak, WorkSafeBC will continue to help when someone suffers a work-related injury. And we understand that even when having a work-related injury under the best conditions is not ideal, now under COVID-19 conditions, we understand that it could be even more challenging to a worker. So that's why it's very important for us that workers understand that we will continue to provide support through WorkSafeBC.com and our online tools. And it's important to note that WorkSafeBC staff may be contacting you from a private phone number during this public health emergency. If your phone is set up to block calls from a private or anonymous numbers, you may miss their call. please consider changing your phone settings temporarily in order to receive services. Now, let me talk a little bit around additional resources that we have. First of all, we have links in our website and some information from other websites that are supporting in this situation. First is the BC Center for Disease Control. The second support agency will be the Office of the Provincial Health Officer, which provide notices and guidance on any situation that may arise over the next days or weeks. We also have links for HealthLink BC, which is their agency that has all the information related to health support and symptoms, and the symptom self-assessment tool that I discussed earlier for any worker or any person of the public that might think they have COVID-19. Now, the resources that we have for employers and businesses are listed here in this slide. First of all, again, the BC Center for Disease Control has information specifically for employers and businesses on how to reopen. Also, the government of BC has developed a business continuity planning checklist to help businesses prepare staff and operations for potential businesses disruptions during the COVID-19 outbreak. Also, Small Business BC operates now a BC Business COVID-19 support service, which will serve as a single point of contact for any business throughout the province looking for information on resources available during the pandemic. The Canada Centre of Occupational Health and Safety, CCOHS, is also developing a number of resources, including fact sheets and workplace posters outlining effective hygiene practices to help reduce the risk of exposure. Now, let me talk about some additional hazards or risks that could arise in the workplace as part of the pandemic. First of all, mental health. We know that COVID-19 has impacted businesses, livelihoods, and lifestyles in very challenging ways. Particularly small businesses and workers may be affected by the anxiety, stress, and uncertainty created by this outbreak. It is important to remember that the mental health is just as important as physical health, and employers should take measures to support mental well-being and health. Workers in the workplace may also be affected by the anxiety and uncertainty created by the COVID-19 outbreak. It is important to remember that mental health is just as important as physical health, and to take measures to support mental well-being. These could help them be more effective at work, take care of themselves, and they may even be able to help other people they work with. In this slide, you're seeing all the different resources that we have collected from different organizations that provide support materials in case you're looking to provide assistance to your workers on the mental health situation. Now, let me discuss a little bit of best practices for work at home activities. So employers are asked to consider having workers to work remotely, and we discussed this as part of the safe physical distancing requirements. So many health and safety roles, rights and responsibilities of both employers and workers are just as applicable for at-home workers that are for any traditional workplace. So it's basically the same. Some guidance on key health and safety requirements when working from home include requiring employers to conduct an assessment of their workplace at home, having protocols for evacuation in case there is a situation happening at home that puts the person at risk, reporting workplace injuries, and practicing check-in or other procedures to make sure the worker is safe. You also need to think about ergonomics at the office, and that's an important thing that is discussed whenever we are defining how workers are adjusting their workstations for this. So in the links that I'm putting in this slide, you will find all the information around how you can organize your home, how you can provide recommendations to workers around these situations. And I'll finish my presentation with my contact information and also saying thank you for your time. In case we are not able to finish or to complete all the questions, you can always send a message to the email address that is right now in the slide, and we will make sure to answer all your questions. Over to you, Stephanie.
I think it's going over to me, actually. It's
sorry.
Stephanie's, yeah, she's in charge really, but I'm just the face. Thanks, Jose. That was a lot of great information out there. Lots going on. So if you have any questions, please put them in the chat room there. We've got about 10 minutes here to answer your questions. I'm sure you have some questions there. I've got a couple here that were submitted earlier. First one was, how do we navigate bringing back staff? How do we navigate bringing back a staff member back to our work office environment with procedures in place based on WorkSafeBC guidelines, and they will also be working in a warehouse type workplace at the same time? So they're working in two separate workplaces, is what I read.
Okay, so regardless of whether a person is working at separate workplaces or not, the important thing to consider here in your policy will be around making sure that workers understand that whenever they are developing symptoms, or they have, or they believe that they have come in contact with somebody that is a positive case of COVID-19, they stay at home. That will be the key policy that will ensure that whatever the situation is around the employment dynamics of the workers at your site, they will make the right decision whenever they feel that they have been put at risk, either in one workplace or the other.
Okay, good answer. And you mentioned ergonomics about the home office. Just let everybody know that we have a specialist in that. We are just setting up a time to have a webinar on home ergonomics. So Dan Robinson's agreed to do that. We're just working on the final details. So look for that coming up soon, because it is a big issue. If you're working at home, having a safe work environment, safe setup. And so Dan Robinson, who specializes in this field, will be doing a webinar, and we're just nailing down the date right now, Steph. Is that correct? Yep, she's nodding approval, yeah. So I've got a couple questions online here, and Megan's answering them, but I'll ask them anyways. Philip, who's at the Evergreen Center, or I believe he's the new executive director over there. Welcome, Philip. Says, thanks for the presentation, the guidance. Is there guidance on cleaning workplaces, especially public washrooms and other facilities?
Yes, we have added guidance specific for cleaning surfaces, and that will include public washrooms. Of course, the process is more or less the same as we have for other washrooms. You need to identify your high frequency touch surfaces, and you need to make sure that you have a plan to clean them in regular intervals. And you will find a specific document that outlines these steps. And there is also a poster that shows all the information around the hygiene practices that need to be followed at washrooms.
Okay, so define regular intervals.
We are not prescribing a specific interval. An example that I discussed today is end of shift wipe down of all surfaces, but it will be depending on the frequency of where people are touching these surfaces. For example, a public washroom will have definitely a higher risk profile than a washroom that is only used by a couple of people. But we are not prescribing a specific frequency. It will be defined by the employer when doing the assessment.
Makes sense. And the other question he has there, and if you've got the answer to this, you're probably a rich guy. How long do you think the physical distancing measures are expected to be in place?
We are currently following the provincial health officer instructions on that. So it will be up to them to define when these measures are going to be finishing. Until now, we are providing guidance on how to do it, but yeah, it will be up to the provincial health officer to define that.
Yeah, I suspect it's going to be a while. Susan from New Earth Marketing. Hey, Susan. What does a company require to have in place and need to have public on their website if they go to client locations which we cannot regulate? For example, service providers, inspectors, real estate agents.
The most important thing here is to define how you're going to coordinate with other locations that you're visiting. We understand that some situations might be under different jurisdictions, but the important thing here will be to have that discussion before you arrive to that place. Regardless of whatever workplace or site anybody is visiting, the same rules will apply. The only thing is that you need to make sure that you understand how to apply those rules, or what are the specific protocols at the workplace. So people traveling will need to have think a little bit more about what's the plan for the day and discuss what are going to be the specific recommendations that are coming from their own employer and are also coming from their location they're visiting.
Okay, and Megan has posted a link on here for cleaning and disinfecting. So there's a link on there on the chat. So if people want to look at that, there's a link to the cleaning and disinfecting. Jill's asking, says, thanks for all the great info. Where can we find specific info, which cleaning products to use for cleaning? Could that be on that link, Megan? I'm guessing cleaning and disinfecting. So which products should we use?
Yeah, there's a government link. I will find it and post it in this chat room, and they've evaluated all different types of chemicals that are currently approved at this point to kill COVID.
Awesome, that's great, thank you. And another question, who will be conducting spot checks of business to ensure compliance with COVID regulations?
It depends on the specific situation. For example, WorkSafeBC, as I discussed earlier in this presentation, will provide consultation, education, and in some cases some inspection to employers. But we will be focusing on the occupational health and safety side of things, more around what I discussed around the safety plan, whether you have protocols in place, whether these protocols are keeping workers safe. But we understand that there are also other agencies that might be inspecting or providing support to employers. Could be a bylaw officer or could be a public health officer, and they have different scopes of application depending on what is the specific mission of the organization.
Okay, and Fatima is asking, I believe Port Moody Arts Center. We have two classes of employees, five full-time year-round employees and 40 casual seasonal employees and summer students. Do we still need to create a WorkSafe committee, or is consultation while the policies are being developed enough?
There are specific considerations for seasonal workers. What I can do, I don't remember what are the specifics around this case for seasonal workers. So what I will do is I will go and research that one back and come back with an answer.
Okay, yeah, if you send off to Stephanie or myself, we can get it over to her. That's fantastic. Megan's posted on there the hard surface disinfectants and sanitizers that are approved by Health Canada, or the Government of Canada, looks like. So that link is now up there. Thanks for doing that, Megan. That's fantastic. Any other questions out there, folks? We got a couple more minutes if we need to use them. I had a question that was submitted earlier about information regarding tour transportation opening. I guess he operates a small tour company, has a van with 15 seats. Any ideas on when that would be opened up? What phase is that in? Any feedback on that?
Yeah, the answer to that one will be the agency that defines which businesses will be reopening or not is the BC government in conjunction with the public health officer. So in this case, WorkSafeBC cannot provide any specific guidance on whether a business can open or not. My recommendation will be to contact directly the BC government through the website has their contact information over there, or we can also provide you the best method to contact them. But they will be the ones who will need to take note of this, and will need to provide clarification if there is any situation where a business might not fit perfectly into the descriptions into the phase 2 plan.
Okay, and a question here come up a couple times. Sorry, go ahead, Megan. You say something?
Yeah, take a look. To find that government resource, you need to look up BC's restart plan, and that's where it talks about the defined phases. And then if it's not clear, as Jose was saying, you need to reach out to the government. The local MLA should be able to provide further details on what may or may not be included in each of those phases if it's not clear.
Okay, and you can always reach out to us and we can help you find the answer too. What is being done with public cafes, etc., who have not provided hot water in the washrooms, whether for staff or public? Will this be monitored as well? So there seems to be a little bit of issue about hot water in workplaces. Employers or owners are trying to save a few money by a few bucks by not having hot water. Is this a requirement to have hot water in the workplace?
This is going to be a PHO mandated regulation, not a WorkSafeBC regulation necessarily. So I recommend you take a look and see what your public health authority requires. There are alternatives that are accepted if hot water is not accessible, but those are all dependent on the unique areas that you work in. So if you have a particular area and you want help researching, then contact Jose at his email address there, and we could help find the link to give you more guidance on that.
Okay, fantastic. Great answer. And another question from Christine. In regards to employees at work who start to feel sick at work, you mentioned having protocols to find them a way home. Is there an expectation for the employer to get them a way home, or can the employer have them call a family member to get them home? How do you work that?
So the first part of my answer will be around the employer is responsible to define that in the protocol. Now, to the second part of the question around the expectation from the employer to provide such transportation, that will be something that I will need to confirm, or I don't know if Megan may have additional information on it, but I will need to research a little bit more on whether this is a formal expectation or not.
At this point in time, related to COVID, it's not an expectation of WorkSafeBC, but as a part of your first aid program, you should have a defined process for how to take care of workers that become ill or injured while at work. So as a part of that program, you should define what your procedures are related to that.
Okay. I don't see any other questions. Anybody else anything you want to type in there, or will? Christine says, thanks for that answer. Appreciate that. Seeing no more questions coming in. Anything on Facebook, Steph? No, we're good. So I think we'll wrap it up there. Your Jose's contact information is there. It's on the screen. So you know how to get a hold of him if you've got further questions down the road. This is going to be saved. The presentation is saved, so you can go back and look at the links that Megan's put up there. Tough circumstances right now. It's been an interesting process for everybody to go through. We appreciate the patience of everybody, and I think our civil service, WorkSafe, and the government officials, the non-politicians, are doing a really good job trying to navigate what directions are coming down and do it in a timely manner, putting stuff in place that's normally would take weeks, months to put in place. They're doing it in days. Measuring in days instead of months. So thank you for all the work, Megan, Jose, you guys are doing. And as Jose said, information's changing all the time. We, the chamber, have been doing a really good job of getting information out every day that's new. So as soon as we get it from Jose or Megan or any other source, we will sending out our email list. So again, thanks, Jose. Thanks, Megan. Thanks everybody for attending. We will we'll see you down the road. We got a couple more webinars coming up in the next week or so. Look for that on how to keep your office safe and a couple other things coming up. Have a great work day out there. We'll talk to you soon.
Thank you very much.
Thanks, Jose.